Hello, everyone. This is Bonnie Young. Welcome to the Health Information Technology and Georgia Health Information Network monthly webinars. Today, we actually have our introduction of electronic access to lab results. I'm Bonnie Young, the DCH Health Information Technology Program Manager. I'd like to welcome you to the interoperability webinar, Electronic Access to Lab Results. Interoperability is a secure use and exchange of health information. One way Georgia is leading in the interoperability effort is with the Georgia Health Information Network Clinical Viewer. The Georgia Medicaid providers can access GeHIN via the Georgia Medicaid Management System known as GAMMIS. Our presenters today is Lynn Hood with Georgia Health Information Network. She'll give us the overview. We also have Pamela Matthews with GeHIN. Pamela will provide us with the electronic access to lab results details. Before we begin the webinar, I'd like to review a few housekeeping tips. This presentation is being recorded. If you have any questions, please submit them via the chat feature or the raise the hand feature. We will unmute the phone lines after the presentation. You have to press *6 on your phone to unmute your line. The mission of the Department of Health, the Department of Community Health, is that we actually plan to provide provide access to affordable quality health care to Georgians throughout the effective planning, purchasing, and oversight. Our partnering for success, the Georgia Health Information Network and the Georgia Health Information Community Health, we actually work closely together to ensure that providers and caregivers can access patient health information at the point of care to optimize outcomes and reduce costs.
Excuse me, Bonnie, it's Lynn. We seem to be having a problem viewing your screen.
Thank you. Everyone hold 1 second, please. Hi, Lynn. Can you give us feedback? Are you able to see it yet?
It says waiting to view Health IT DCH's screen. Pam?
I can actually see the GAMMIS slide, access for authorized medical providers.
It's something on my end. I'm very sorry. Y'all keep going and I'll get that fixed.
No problem. Thank you for sharing. And yes, we are actually on access for authorized medical providers. The good news is that our medical providers have access to the Georgia Health Information Network, GeHIN, through GAMMIS, through the web portal. We actually have the clinical viewer, which is for GeHIN. It's a one-click sign-on once you actually access the GAMMIS portal through the details of the terms and the conditions. We actually have a training facility. We have a training video that you actually can learn how to do part 1 and part 2, which is first you have to accept all the terms and the conditions one time and one time only. And then from there, you will be able to continue to do a single sign-on whenever you go into GAMMIS. We also have another video, that's part 2, that gives you the details associated with the clinical viewer and how to operate the clinical viewer. At this time, we would like to welcome Lynn Hood, who will give us the GaHIN overview, and then we'll have Pamela Matthews to provide us with the electronic access to lab result details. Welcome to the broadcast, Lynn.
Thank you. I appreciate that, Bonnie. I'm Lynn Hood. I'm the marketing manager for GaHIN. I want to give you a brief overview of what GaHIN is, our statewide health information exchange. If you can just follow along, I am looking at this on, somehow I'm not seeing it online, so I'm looking at the slides. So GaHIN is dedicated to creating a healthier Georgia through the use and exchange of electronic health information. Our goals are to advance patient-centered health care, to increase efficiency, and to improve the overall health of the state's entire population. Next slide. If we can be on the creating a statewide electronic network, you can see we connect a whole range of different healthcare providers across the community of care. We have hospitals, government, 5 government agencies, dentists, long-term care, school clinics, and even EMS. We even have some EMS ambulances that can access records while they're transporting patients. Next slide. We're a federated hybrid model, and so instead of holding data, and people are often confused as far from a privacy standpoint, we don't pull data, we index it, and the patient information remains with the provider until an authorized provider comes in and requests the data. And so that's what our members access, and it pulls all that data together and delivers it in real time. So we have 2 products. Next slide. One of those is GeorgiaDirect, and the second is Georgia Connected Care. And I want to tell you a bit about both. Next slide. So GeorgiaDirect is a free email messaging service. It is HIPAA compliant. You can use it with sending materials to other authorized healthcare professionals. You can transport, I believe it's 40 documents up to 400 pages each, and plus images and other information using it. So it's easy to use, it's online, and it's completely free. And it's a great adjunct to connected care for someone that's not connected to the query system and just needs to transport that information. We had 750,000 send and receive transactions, and you can see that's up by 50% over 2017. Next slide. Georgia Connected Care is GaHIN's query-based solution, and so providers can go in through their EHR, it's integrated in, and access this patient health data. It pulls it all in together. So we've got almost 13,000 connected providers as of the end of 2018, and we doubled our number of queries from 2017 to 2018 with over 2 million. We have indexed records, which are not individual patients, but indexed records totaling 32 million master patient index records that we have indexed. Next slide. And we're connected to a wide range of organizations, so 5 state agencies, including Georgia Medicaid through the Department of Community Health, 4 health system hospitals. We're about to announce Wellstar is the 5th major health system hospital that's directly connected. We have 4 regional HIEs that go, regional health information exchanges that go out and connect within the communities that they serve, 4 care management organizations, a few specialty connections, and connections to the Veterans Health Administration and the Department of Defense. So at this point, I'm going to turn it over, if we can go to the next slide, about why you should provide electronic access to lab results. I'm going to turn this over to Pam Matthews, who is our Chief Operating Officer, or Chief Operating Director. I get lost, Pam, and keeps things running at GaHIN. Sorry, Pam.
That's quite okay, Lynn. I'm the Executive Operations Officer, but the bottom line, I take care of day-to-day operations. But thank you, Lynn. If we can go to the next slide, please. Okay, so as we all know, EHRs really increased in not only deployment, but more significantly adoption and actual use through the other caretakers and caregivers along that patient care continuum, especially physicians and the extended physician practitioners, with the adjunct of high-tech and meaningful use funding opportunities. Also, along with those funding opportunities, we saw increased activities around health information exchange or that data sharing capability. So with the building blocks of having an EHR combined with the capabilities of health information exchange, we actually saw the utilization of information sharing across that patient care continuum like we really haven't seen from an electronic perspective before. And I like to phrase it's along that patient care continuum that also not only includes those hospitals, but also those physician practices, as well as clinics and other significant and very important caregivers along that patient care continuum. So with that information sharing, what we actually started seeing from a practical perspective is that everything that an EHR was really focused on providing, which was information about the patient, the care information notes, the assessments, images, medications, all of that began to be spread across the caregivers that were engaged with that specific patient. Among that information also was lab results. So as you can see, we have referenced several reports here, and on the previous slide you saw 74% of providers reported that they benefited from the use of EHRs. So while there may be a push-pull in terms of the actual use of EHRs at the clinician, at the grassroots level, overwhelmingly we know EHR is a significant vehicle that impacts patient care. So why lab results? Lab, I believe personally, is one of the most impactful diagnostic tools in patient care delivery. And why is that? A lab result can help facilitate identification and understanding of a patient's presenting symptoms. Sometimes it's not very clear-cut when a patient presents in the clinician's office, in a clinic, an urgent care center, or even the emergency department. So labs can help quickly identify underlying issues, such as an elevated white blood count can be the first indication of infection when there's not any overt symptoms. It can help rule out issues leading to a diagnosis, and then lab results in conjunction with other diagnostic tests and the physician's assessment can help lead to appropriate diagnosing and identifying the best treatment plans. Also, with treatment plans, monitoring specific lab values may help to ensure that the appropriate medication dosing levels are in play and that the patient is reacting appropriately. And it can also help in terms of ensuring if a medication may impact another organ, that monitoring that organ through lab tests will help ensure that the organ's function is appropriate and not being negatively impacted by the required medication. So the benefits of information is that it helps to reduce duplicate testing, reduce cost, improve care coordination, and more importantly, we're seeing that it is actively helping to provide the necessary information at the point of care. There's been several research studies that's been identified. This particular one on the slide actually demonstrates the result of exchanging that information across multiple care providers. As you can see with this slide, it's not a theory, it's not a myth. If we have access to lab values that are provided in other patient care settings and they're accessible, such as at the hospital level during a patient encounter, the number of lab tests ordered during that hospital-patient encounter significantly is reduced. As you can see from the black line in comparison to the cohort that did not have access to other labs from the patient care continuum process. Next slide. So, as I said, it is no longer a myth. It did confirm that it does directly impact not only the results of patient care delivery, of having access to those labs from other patient care sectors, but more importantly, there can be some intangible, such as the patient impact. They're not actually stuck more than one time, especially if the patient knows that they had, say, a particular lab drawn 2 weeks ago. They're in the hospital ED, and they're telling them, hey, I just had that lab test. So there's also intangible. But I think with this particular study, it really demonstrated the significance of having that patient information longitudinal across all the patient care settings from all the providers. Next slide, please. Another study actually zoomed in on the accuracy of lab results. And this was a 2016 study. Interesting, there were 45 institutions that participated, but they narrowed it down to 16 different laboratory tests, which not only included clinical labs, but also anatomical pathology, which is a little bit more complex lab, but can be very significant in impacting the diagnosis of treatment plans and determining appropriate diagnosis. So we see that there's various components. A lab test is just not a lab test result. It really is all the data that is required for a complete lab test present, and is it accurate? And so with this study, they actually reviewed both the normal and abnormal results. So they actually took the entire gamut of the potential results that could occur. Next slide. So with the results on the next slide, if you look at the first bullet point and the last bullet point, through electronic transmission of lab results with an electronic health record, we saw that there was a definitely increase of accuracy, both in that 90 percentile. However, there was a lower compliance, if you notice, with the second bullet point with the actual test results containing all the essential reporting elements. This study actually warrants additional investigation to understand exactly what happened there. Was it at the point of ordering the test, and maybe the ordering physician or ordering provider did not actually order the correct test that they were thinking about? Or was it something other that was into play? But the point of this is that with electronic lab results in the ordering process and in the resulting presentation of the results, there is a definitely increase in accuracy in the overall process and the overall end results, using electronic ordering and electronic result and sharing that information electronically. If we go to the next slide, this is just a summation of an overview of the breakdown of the accuracy. With this, they actually focused on in-house rather tests performed within a hospital setting, for example, or did they use a reference lab where the providers actually drew the test and then sent the sample out to a third-party reference lab. So as you can see with both of these, as long as there's electronic activity involved, you have a higher degree of accuracy with the transmission. Now, you will notice on both of these categories, manual entry into the EHR, and then also with the reference lab scanned, as well as faxing could be a possibility. That's where, with GaHIN, Lynn had mentioned direct. We are in the age of electronic activities with our iPhones, with the electronic health record, with exchanging data statewide as well as across the nation, but there are pockets in the patient care delivery continuum that are not as sophisticated. So I like to say we meet providers where they are. And as Lynn previously mentioned, we have direct secure email. And this is another option that we actually utilize with our providers who may not be at that point of exchanging data electronically. What they can do is utilize direct for that means. Next slide. And that actually leads us into the discussion of what does it mean to access lab results through GaHIN. Next slide. And leading right into that is GeorgiaDirect, which is our secure email product that we offer. And again, as I just described, that is a means of securely exchanging information between providers that will help speed up that process and also speed up having the physician that at the point of care has all of the appropriate information needed to diagnose and treat that patient. The other service that we offered is our longitudinal patient record, which can be seen in our clinical view or Georgia Connected Care. To wrap up this presentation, I'll talk a little bit about some of the future activities with reference labs that we are currently working with. Next slide. So using GeorgiaDirect, the primary scenario is that a patient visits his physician office. They determine lab work should be performed. This is a little bit different scenario than what I've just previously mentioned. And the patients at this particular physician's office, they do not draw specimens. So the patient says, hey, wait a minute, a reference lab is right around the corner from my house, so let me go to that Quest or LabCorp sponsored reference lab. And they take the order and they get the blood drawn, and the actual results are resulted from that reference lab. Now, what can happen today with using GeorgiaDirect, the reference lab can actually deliver the lab results directly to that physician through the direct secure email. Then once that physician has that result, then they in turn can integrate that into their EHR. And next slide actually shows a pictorial of that workflow. And again, GeorgiaDirect is not only used at the physician's office, but is also used by many of our hospitals as well. Next slide. The other service we offer is Georgia Connected Care, and that's where we have our longitudinal patient record to display. And it also includes providing that information with CCDs. This particular presentation will just focus on lab, and we have our test patient, Helen, and Helen can be very sick because we have had Helen in our test system for a very long time, and we hope one day that she does get well. But for right now, Helen has several lab tests that the physician needs to see about. So as you can see with this particular side, there's a tab that will focus on first entitled Labs. And if you would like to go to the next slide. So with the next slide, what you will see will be the most current labs that has been ordered for Helen. And as you can see on the right-hand side are the actual activities that the clinician can use on the fly to actually change the presentation and the display of the data and the amount of data that they would like to see displayed at one time. Also, more importantly, is the legend that displays. So the legend really identifies what does that mean in terms of the lab results that's displaying? Is it normal? Is it low? Is it out of range? Is it high? So that pictorial view is very important for the clinician because they can quickly scan the lab results and quickly hone in to the actual values they need to pay attention to. Another view, if we go to the next slide, is really this view magnified, where we can actually see this much clearer. And in this particular presentation, the request has been to see the most recent lab values, which you can see here. And we have a high result in the bun, and then a low with the sodium. So again, it's a presentation clinical view that the clinician can quickly assess and hone into. It could be, if I'm the clinician, I'd like to see more of a traditional view. It may be the view that they have been using for many, many years. While this is important, they may want to see some additional information, such as what is that normal range to determine if the bun is high, where does it fall within that high range? So if we go to the next slide, you will see another view that's from the reports. Lab Reports tab. And this is where you can actually see more of a listing of the lab results, what the value is, and what the normal range, and of course what the status is. And many times that type of presentation is more important for the physician than the previous presentation. Many times it also is a function on clinical preference and practice preference. So if we go to the next slide, what we can see here, the difference is that the reports, you can see the actual the ranges, and also with this you can print. So again, if you look on the left-hand side, you'll see select to print. So if the physician would like just to print out a particular set of labs for whatever reason, they can print that out. That is an option that's available if they would like. Next slide. So that is a very quick overview of our clinical viewer and how laboratory results are displayed within the clinical viewer, and some options that the physicians or clinicians have in utilizing that viewer in the presentation. Some of the projects that we are working on right now has to do with Quest and LabCorp. We estimate that maybe around 75% of all the labs in the state of Georgia, this is just a rough estimate, most likely is coming from a third-party lab. So it's very important for GaHIN to work with our third-party reference labs. We are currently working with them, and what that means is that we will have a copy available in GaHIN of third-party reference labs. Now, where we are in the process, we are in the final review of legal agreements with our organizations. As you can know, that can take on some lengthy time, but we are in the process of finalizing those legal agreements where we can execute them. And in parallel to that, we're also working with defining what that workflow will actually look like once you have the clinician in front of the computer, they're in the clinical viewer, what would that workflow, how would that access occur? So we're working out the details where we can map that out very specifically and cleanly, so we can share that when we roll this service out. Now, interesting, with all things, we have consent that we all have to deal with. And so with this particular service, what we know is that providers must opt in to share the results. So one of the things we will be doing, especially in working with Quest and LabCorp, and maybe even with DCH and our colleagues, Bonnie and folks, is working to get the word out to the providers that if they would like their lab results shared, they must help us get that consent. So we will be rolling that out ahead of time in terms of our timeline so everyone will know, and also information about what that means to get that consent and what that process is. So in wrapping up, what we've demonstrated today is that it's not a myth. Having patient clinical information available in an EHR is truly beneficial and impacts not only the clinical care, but also the operations of clinical practice in terms of cost savings, and more importantly, impacting the overall patient care delivery across that continuum through various clinicians along that process having access not only to lab but to other information. And that's where GaHIN plays a critical role in sharing that information across the participating members. And we do that in two ways. One, through GeorgiaDirect, which is the secure email, where we meet the providers at the point where they need to have help in terms of electronic facilitation of information sharing, but more importantly, with our Georgia Connected Care, which has our clinical viewer, and that's where a physician has many options to go in to view lab results from various points of care and actually be able to actually look at how they would like to have those lab results displayed for them that's more beneficial for them in terms of their particular clinical practice and how they like to view the results. And then we wrapped up with things to come, which is our new service that we are very much looking forward to rolling out. That it involves third-party reference labs with Quest and LabCorp. So with that, that is the end of my presentation. So I will turn it back over to Bonnie, and we can go from there with any questions.
Thank you, Pamela. We appreciate the detailed information associated with the lab results. And thank you, Lynn, for your detailed information associated with GaHIN. We'd like to open it up to all of our guests who's on the panel with us, who's on the webinar with us. If you have any questions, we will stop the broadcast at this time, or stop the recording at this time, I should say. And then we will allow you to give us any questions through the chat feature. We'll hold 1 second so that we can determine if any of the questions will come through. 1 moment.